Hi, I'm Melanie from UWorld. We're looking at next-gen practice questions from the UWorld question banks. Now we have an overview of the drop-down NGN question type. Okay, so drop-down items are another item type that's going to be on the NGN version of NCLEX coming out in April of 2023. Drop-downs are a lot of fun. They are kind of like filling in the sentence, which I think is an item type that we've seen before, maybe not in your college years, but I'm like fill in the blank is not something that feels very foreign. So in the drop-down format, it's from picking from a box. So here it says complete the following sentence by choosing from the list of options. So this is just a silly little sample. We'll look at a real clinically related one in a second, but just for the sample, it says, when you look up at the sky, you can often see the blank and blank. So we'll go ahead and investigate and see what's available in those drop-down boxes. So here we have options like the clouds, the grass and trees, and the ocean waves. So knowing that we're looking up in the sky, probably we would click the clouds. So when you click on that, it'll fill in the box for you. So it's in here in the drop down, and then once you click it, it goes into the box and it stays there in the sentence for you as you finish out. And then you can move over to the other drop-down box and click it. And it's a little bit different because you can't see the options until you click it. But this one we're comparing, what else do you see when you look up in the sky? Do you see elephants walking around? Do you see birds flying, fish swimming around? Most people probably birds flying. Maybe if you're cloud dreaming, maybe some elephants walking around. So you fill in those two boxes by clicking those. And then we'll kind of look at the scoring. So for this one, it's the same as the other ones where you don't lose points for incorrect responses. They've told you exactly how many answers to give. They said fill in these two boxes. So they don't typically take away a point for answering it incorrectly. They asked you to answer it. So here you get 1 point for answering the clouds correctly, and then you get 0 points for the elephants, but you don't lose a point. So your total score is 1 out of 2 points rather than 0 if they had subtracted a point for an incorrect response. So that's really beneficial for students looking towards the NCLEX. Now let's pop over and look at an actual clinical one that makes more sense for what a nursing student would see. This is the same case study as the other videos, patients in the hospital with DKA. This is the third item in the series. So we are kind of analyzing what's going on and trying to decide what to do next. Here, if we look at the sentence, it says, and we've already reviewed the information, and after you've kind of made your analysis of the information, you can move over to the question, which says, complete the following sentence by choosing from the lists of options. So again, we're just filling in the blank. Based on the client's findings, the client is most at risk for, and then we can drop down and see some options here. So we know what they're experiencing. They have DKA, but where can it go from here? So our options are peritonitis and sepsis. That seems reasonable if you're having some sort of stomach condition. Fluid volume deficit and hypovolemic shock. Absolutely irrelevant to DKA. There's a lot of fluid changes in DKA, and you can really easily get hypovolemic and dehydrated. Intra-abdominal hemorrhage and hypovolemic shock. Hemorrhaging, not as appropriate for DKA, but abdominal pain definitely is. So I can see why something intra-abdominal may be related, but we'll click for now, I think, fluid volume deficit and hypovolemic shock. It just seems to be the one that fits the best. And then here we have to explain our answer. So we chose that answer. Now what's telling us? So we have to say, as evidenced by the client's blank. So we go ahead and click on this and we can say, well, it's because of their vital signs being off. I mean, if we look over at the exhibit, their blood pressure is low and their heart rate is pretty high. So that's a good answer. Abdominal pain, they're definitely here with some abdominal pain. That may be the reason they came in. And then we still are having some unknown information about their menstrual period. So that could be related. For this one, I think maybe they did talk a lot about abdominal pain. So maybe we'll click that one. And we'll go ahead and submit. And again, we can't see the explanation yet because we haven't finished the case study. So we'll flip over to one that is finished. And then we can see the explanation. So here we responded in the same way. Fluid volume deficit, hypovolemic shock, evidence by abdominal pain. So that piece was correct. But then that second piece was incorrect. So then we could have had 2 total points for this item, but we instead had 1 because we had 1 incorrect response. They didn't take away a point for it being an incorrect response because they asked you to put something in that blank. So instead, it's just 1 point out of 2, which is awesome. You didn't have to have everything exactly right. You still got credit for the item, so that's great. The explanation continues on from there. But that is the summary of the item type. Whether you're taking the current NCLEX or the next generation NCLEX coming on April 1st, 2023, practicing NGN questions will help you prepare for the exam and bedside practice. Visit nursing.uworld.com for more information and to see our options for RN and PN and to start practicing today. Thank you.